Good morning to our honorable delegates here and the dignitaries here present, and to all the participants here. I recognize you. I am MUHAMMED LAMIN SAMBOU, and it is a pleasure to have the opportunity to present one of my projects entitled Association Between Sleep-Behavioural Threats and Healthspan, a one-sample Mendelian randomization study based on participants of the UK-Biobank. And in this study, as we conceptualize it, two fundamental questions that we ask: is our sleep behavior really associated with healthy life expectancy? In other words, is sleep behavior associated with disease mobility and mortality? And the second part of the question is that if there is an association, is this association actually causal? So epidemiological evidence have shown that environmental factors and lifestyle-related factors contribute to about 85% of disease mobility and mortality. Sleep behavior is one of the lifestyle modifiable factors, and it has been associated in many physiological processes. So which makes it a very, very important factor to examine. And also, evidence have also shown that lifestyle modifiable factors also can in turn contribute to to modifying our genetic predisposition. So also, evidence have shown that about half of the population of the world is suffering from or is having sleep-related problems or sleep disorders. In China, a study showed that up to 30 million people have sleep-related problems. And also in America, a study showed that up to 60 million people have sleep-related complaints, which makes this a significant public health problem. Sleep also is been associated with a variety of complex diseases, including cancer, cardiovascular diseases, diabetes, mental health, which could be due to which perhaps could be due to the its disruption of the HPA. It means hypothalamic pituitary adrenal axis, and also perhaps through the increased activation of the sympathetic nervous system, and also increased activation of inflammation. So, like I said, we want to look at the association between sleep behavior and healthy life expectancy. What is healthy life expectancy? It means that the amount of years you live in full health without chronic diseases and disability. So, over the years, we have seen that life expectancy is increasing, actually, especially in developed world, in developing countries. But we have not seen a proportional increase of life expectancy with healthy life expectancy. It means that people are living long, but not with full health. People live long, but with chronic diseases. And as epidemiologists, we want to help, or in fact, as a medical professional, we want to help people to live long, healthy, and productive lives. So this goal is not been achieved. That is why it is of importance to look at the association, or to look at factors that contribute to our disease susceptibility. So, so due to the limitation of previous studies, like no much studies or scarce studies exist that observe the association between sleep behavior and healthy life expectancy, or sleep behavior and disease mobility and mortality in humans, and also limited sample sizes. We build our study on this, and then like I mentioned, our study is in two phases. We look at the association between, is there an association between sleep behavior and healthy life expectancy, and then in turn, if there is an association, is this association really causal? So we utilized single nucleotide polymorphism or genome-wide association studies to perform a Mendelian randomization study, which is a robust study and usually immune to some of the biases and limitations of observational studies, and because it's immune to reverse causality and also residual confounding. And in Mendelian randomization study, we have three major assumptions, which is correlation, independence, and exclusion, which I will explain further later. So the aim of our study is to investigate whether there is an association between our sleep behavior and healthy life expectancy. As I said before, healthy life expectancy means living in amount of years you live in full health without chronic diseases and disability. And the study is in two phases. First, we establish an association, which is an observational study, and then we test this association, whether it is causal or not, through a Mendelian randomization study. So the study was based on participants from the UK-Biobank, which is a cohort study of over 10 years, where participants were recruited using various means, including questionnaires and other devices. So sleep behavioral threats. So here in this study, we considered 6 sleep behavioral threats, which include sleep duration, chronotype, which means the time you go to bed and the time you wake up, and sleeplessness or insomnia, snoring, getting up in the morning, and napping. So to increase our predictive abilities, predictive ability of these risk factors, we created a score, because some of these risk factors, they are not mutually exclusive. So they can occur together. For example, an individual can have low sleep duration at the same time have insomnia problem, or an individual can have sleep duration problem and as well also have snoring. So we created a score based on previous studies. We created a score where we try to group it into a binary variable, where participants who have a healthy sleep behavior, are given a score of 1, and those who have unhealthy sleep behavior are given a score of 0. And this score was further recategorized into a sleep quality, which was grouped into healthy sleep quality, less healthy sleep quality, and poor sleep quality. So our definition of healthy life expectancy, based on a previous study that shows that these 8 events or these 8 conditions are significantly associated with aging, we use these 8 conditions to define our outcome variable, which is health span or healthy life expectancy. So if an individual have any of these events during the follow-up period, you are considered to have a terminated health span. If an individual does not have any of these events during the follow-up study, you are considered not to have terminated health span. So coming to the statistical analysis, as I mentioned, is in 2 phases. In the observational analysis, we perform Cox proportional hazard regression, and the proportional hazard assumptions were tested by Schoenfield residual. And then further to sensitivity analysis that was performed for the observational analysis was inverse probability of treatment weighting, which is also used to minimize the effect of confounding. After that, we also performed the population attributable risk to assess the proportion of this effect in the population. So we also looked at, given that sleep duration is a very, very important phenotype in sleep study, we also collapsed the sleep duration into 6 categories to look at also the hazard risk by shape. And also we also looked at sleep score. We also look at the hazard risk of sleep by sleep score, and perform also cumulative risk score. In addition to that, we perform a stratified analysis based on age, sex, BMI, and polygenic risk score. So we also leverage genetic information, and then we created, we categorized it into 2, which is low risk and high risk. So we use that one also to stratify our analysis. So instrumental variables were leveraged to perform the Mendelian randomization study, as I mentioned. So the most important part of our result is that healthy sleep behavior was associated with reduced risk of terminated health span. And also you can see that 7% of terminated health span event in the population can be eliminated or can be avoided if all the people adopt a healthy sleep behavior. So you can see also that increased sleep duration also and reduced sleep duration was associated with increased risk of terminated health span. Also, the more sleep score you have, the lower your risk of terminated health span also. Cumulative risk curves also indicated that people with a higher sleep score and people with healthy sleep quality also have a reduced risk of terminated health span. So stratified analysis also suggests that corrective strategies for sleep behavior may vary between groups, as we see, by age, by sex, and by BMI. Okay, so finally to our study, we observed that up to 5 sleep behaviors were associated with the health span termination. So is this association really causal? So the Mendelian randomization shows that sleep duration and insomnia are causally associated with terminated health span, as we see. So this result also is consistent with the weighted genetic risk score that we have also conducted, and the sensitivity analysis in this part of the study, which is the MR EGA and weighted median, shows that there is no pleiotropy, which is a type of bias in Mendelian randomization. So in conclusion, in the observational study, 5 sleep behaviors are associated with health span termination, and in the Mendelian randomization, it shows that MR indicates that sleep duration and insomnia are causally associated with risk of terminated health span, which shows that sleep behavior is valuable for the extension of healthy health span. Thank you very much.
Thank you, Mr. SAMBOU. We will have time for a question.